Welcome to the Explainer. So, right now, at this exact second, you are actually doing something unbelievably complex without even realizing it. You're reading. Today, we're totally demystifying how our eyes navigate the world. We'll look at exactly how doctors uncover those invisible, hidden vision problems that can completely derail a person's learning and daily life. It's going to be a fascinating ride.
Okay, here's our clinical roadmap for today. We're literally going to level up our diagnostic toolkit as we go. We'll start with the basics of eye movements, move on to simple chairside observation, and then getting to standardized testing and grading. After that, we'll simulate the reading process, dive into some really cool high-tech eye tracking, and finally wrap up with how we actually treat these oculomotor dysfunctions. Let's jump right into the basics of eye movements. We have to establish the absolute foundation of our clinical evaluation first.
But before we throw a bunch of clinical definitions at you, let's actually feel how this works. Try this for me. Without moving your head at all, snap your eyes up to the top left corner. Now, smoothly glide them down to the bottom right. Bam! That felt pretty effortless, right? But medically speaking, you just pulled off two distinctly different, highly complex neurological operations, and doctors need incredibly precise ways to measure both of them. So, let's equip ourselves with the medical vocabulary. The two vital movements we're looking at are smooth pursuits and saccades. Smooth pursuits are exactly what they sound like, honestly. It's your ability to effortlessly follow a moving target, kind of like watching a bird glide across the sky. Saccades, on the other hand, are the quick, snapping jumps between two distinct targets. Think about reading a book. Your eyes aren't actually gliding across the page, they're making rapid, tiny saccadic jumps from word to word. Understanding these two terms, pursuits and saccades, is basically the key to everything else we're going to talk about today.
All right, moving into simple chairside observation. This is our very first diagnostic level.
At this stage, doctors aren't plugging you into any complex machines. It is purely qualitative. The clinician simply takes an engaging target, maybe a small toy on a stick if they're working with a kid, and asks them to follow it. To test smooth pursuits, they'll usually move it in a double H pattern in the air. For saccades, they'll hold up two targets and have the patient jump their eyes back and forth. What the doctor is meticulously watching for here is the overall smoothness and accuracy. Are the eyes overshooting the target? Are they undershooting? Or maybe they're just losing attention entirely. And crucially, they are on high alert for something called motor overflow. This means they're watching to see if a patient has to rely on excessive head or body movements just to track a simple target. I mean, imagine the sheer exhaustion of having to aggressively twist your neck just to read the next word in a sentence. It's a huge red flag.
Let's level up to standardized testing and grading. We need to assign some concrete numbers to those qualitative observations.
This brings us to the NSU-CO Oculomotor test. We're upgrading from a casual double H pattern to very strict physical parameters. The clinician uses specific fixation targets, usually these little things called wolf wands. For testing saccades, the patient jumps their fixation between two wands held exactly 10 centimeters from the midline. For pursuits, one wand is moved in a precise 20-centimeter circle. By enforcing these exact, specific distances and targets, the clinician creates a perfectly controlled environment. Since the physical mechanics are identical for every single patient, it allows for highly accurate, standardized grading.
And the SCSEO 4-point rating system is incredibly straightforward for this. It turns that raw observation into hard data. A perfect 4+ means the eye movements were perfectly smooth and accurate. Easy. But as you go down the scale, you start seeing the degradation of control. A 3+ indicates maybe one loss of fixation or a slight undershoot. A 2+, that means you're seeing gross overshooting or undershooting, or maybe two fixation losses. And a 1+ is the absolute bottom of the scale. That means an outright inability to do the task, multiple fixation losses, or that uncontrolled head and body movement we talked about a minute ago. This system gives the clinician a totally concrete baseline to measure against.
Now let's dive into simulating the reading process. We're directly applying these measurements to a real-world task that frustrates so many kids.
What's really interesting here is comparing two very popular reading tests. First up is the King-Devick test. It is heavily relied upon because, frankly, it's extremely fast. The patient simply reads numbers out loud as quickly as possible from 3 test cards of increasing difficulty. No fingers allowed to guide them. It's timed and the errors are compared to age-matched norms. But it has one major blind spot. It doesn't account for a child's rapid automatic naming skills. Think about it. What if the child has picture-perfect eye movements, but their brain just processes the names of the numbers a bit slowly? The King-Devick test literally cannot tell the difference. And that is exactly why the developmental eye movement, or DM test, is so necessary. It uses a brilliant mathematical ratio to prove whether a reading struggle is a physical eye issue, a true oculomotor deficit, or just a cognitive processing delay.
Let's break down how this clever mathematical ratio actually works. Step 1. The patient reads numbers from two vertical charts. Reading vertically doesn't really require complex saccadic reading eye movements. It's basically just testing how fast the brain can process and say the numbers out loud. Step 2. They read a horizontal chart. This forces the eyes to make those tiny, rapid saccadic reading jumps. And then, step 3 is where the magic happens. The doctor calculates the ratio by dividing the horizontal time by the vertical time. If both times are super slow, well, it's a brain processing delay. But if the vertical time is totally normal and only the horizontal time is slow, boom, the doctor has mathematically isolated the problem. It is definitively a physical eye movement issue.
Okay, time for our ultimate diagnostic upgrade, high-tech eye tracking. We are moving way beyond human observation here.
Welcome to the world of objective eye tracking. Systems like the Visograph Third, Readalizer, and iLink take literally all the guesswork out of the equation. The patient puts on these specialized infrared goggles and reads some text. While they're reading, the infrared sensors objectively monitor the eyes, giving us incredibly advanced computerized data. We're talking exact numbers of fixations, precise reading speeds, and honestly, most importantly, it tracks regressions. Regressions are how many times the eye loses its place and has to dart backward to reread a word. A human observer could never ever catch all these micro movements with the naked eye, but infrared goggles, they catch every single one.
So, now that we've tracked down and diagnosed the root problem using our escalating toolkit, let's talk about treating oculomotor dysfunctions. The really crucial point here is that treatment is highly structural. It's a step-by-step process. First and foremost, you absolutely have to correct any underlying refractive errors. If a patient needs glasses just to see the target clearly, no amount of eye exercises will help until that blur is fixed. Once that foundation of clear sight is established, the clinician brings in vision therapy activities. Think of this as physical therapy, but for the eyes. Patients practice letter tracking to train those smooth saccades. They utilize saccadic pyramids, which visually force the eyes to jump wider and wider distances with pinpoint accuracy. They'll also use things like Marsden ball activities, which is basically tracking a swinging ball, to physically build up smooth pursuit control and, critically, visual stamina. It definitely takes work, but the brain and the eye muscles absolutely can be retrained.
And that wraps up our clinical journey. But before we go, I want to leave you with one final kind of wild thought. How much invisible, complex work are your eyes doing right now just to watch this explainer? Every time you read a bullet point, your eyes are executing microscopic saccades. Every time an image shifts, you're performing smooth pursuits. The sheer coordination required by your brain and your eye muscles just to navigate the visual world is nothing short of miraculous. Thank you so much for joining me today to learn how we measure and protect this incredibly vital system. Keep learning and keep looking closely.